messaging bill, which is a clean 3-year extension of the Biden COVID bonuses. And when I say clean, I mean all that I mean by that is no reforms, straight up extension, 3 years of a program without any reforms, any revisions, any changes that would actually help drive down health care costs instead of increasing health care costs and get rid of the rampant waste, fraud, and abuse in this program. The Democrats' plan, that the Democrat leader called it on the floor the other day, it's their plan. Apparently, they think that a 3-year extension with no reforms to try and disguise the real impact of Obamacare's spiraling costs is actually a plan. I don't know how you can call it a plan. I came down here yesterday, Mr. President, to talk at length about some of the many problems with Obamacare and the perverse incentives it provides to move employees off of employer-provided insurance and into taxpayer-subsidized plans that have rampant year-over-year increases in premiums. The perverse incentives that it provides to insurance companies to enroll Americans, some of whom don't even know that they've been enrolled, so that the insurance companies can rake in even more subsidies. And then this so-called plan is rampant, and I say rampant, with fraud and abuse. Mr. President, a Government Accountability Office report released just last week found a whole host of problems, including the successful enrollment of fake individuals, Social Security number fraud, failure to verify or sometimes even request documentation, improper payment of subsidies, and the list goes on. And I want you to just take a look at this. This is the finding that came out of that study that was done by the Government Accountability Office, Mr. President. And here was the conclusion. Obamacare subsidies granted without documentation to 90% of fake accounts set up by a government watchdog. 90%, not 10%, not 5%. I mean, if you had a program that had 10% fraud in it, I think that would be a huge red flag, right? Wouldn't you be alarmed by that? I think most people would. I think most people would go, wow, that's a huge number. We need to do something to fix that. This program that we're talking about today, that they want to do a straight-up extension on, no reforms, no revisions, was found by the Government Accountability Office, an entity and agency that Democrats love and support, found that 90% of the accounts that were set up in the Obamacare exchanges were fake. Fake. Think about that. My aching back, Mr. President, you can't make this stuff up. We're talking about tens of billions of dollars in waste, fraud, and abuse on a yearly basis. And they don't want to do anything about it. They just want to straight up extend a program that the Government Accountability Office says has a 90% fraud rate. Well, Mr. President, that's obviously a huge problem, but I haven't even gotten to the central problem. And that is that Obamacare has utterly failed to control health care costs. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. Now, let me just repeat that, Mr. President. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. 221%. That means Obamacare premiums have grown at approximately 5 times the rate of inflation. So much for making health care more affordable. Now, Mr. President, this graph, I think, illustrates that, and actually this understates the problem, because this shows since 2014. In the first year of its inception, when the Obama exchanges went live, there was a huge increase that the insurance companies built in their premium cost to cover all the things that they had to cover in the new program. So since 2013, that number is 221%. But even since 2014, when the exchanges were fully up and operating, it's had a 129% increase in premiums at the same time that the group market, in other words, the large and small group market where a lot of people get their insurance coverage through their employer, was going up at about half that rate, 68% in the small and large group market, which is where about 150 million people get their insurance. And frankly, the more people we could push into that market, it will not only lower their costs, but it also spreads the risk among a bigger pool. And that ultimately is the way in the long term you want to spread your costs. But what Obamacare does, because it uses taxpayer dollars to subsidize and pay insurance companies directly. Premiums go directly to the insurance companies. So insurance companies are making bank. They're getting enriched by this. But what it does at the same time is there's no incentive to control costs. And it's pushing people into that market. Because if you're an employer, or an employee for that matter, because most people respond to incentives, and you are told that you can get into a market where the taxpayers are going to cover it, and the employer is going to say, well, why should I continue to pay for the health insurance coverage for my employees if I can have the taxpayers pay for it? And so it's pushing more and more people out of the group market, this market right here, where there's a 68% increase, still way too much over the last decade. They're pushing more and more people out of that market into this market, which is double the rate of increase in premiums, and that doesn't include, as I said, the first year in its inception. If you add that first year back in there, that number is 221%. So you've got this system that is pushing more and more people into insurance coverage where the rates are skyrocketing, where the payments are going directly to the insurance companies, and where lower income taxpayers are subsidizing higher income taxpayers because there are no income limits. So now you can have people making $500,000, $600,000 a year are getting subsidized by the federal taxpayer, people making $40,000 or $50,000 a year, at a cost to the federal taxpayer in their bill alone, which is just a 3-year extension, of $83 billion. You tell me in what universe that makes sense. That's astonishing. To have a program where 90% of the people who were fraudulently enrolled got approved. A program where the rate of increase is twice the rate in the group market and 3 times the rate of inflation, the consumer price index, over the same time period. And the insurance companies are getting rich. Lower income taxpayers are footing the bill so more affluent Americans can have coverage. And the American taxpayer is paying $83 billion just for the 3-year extension. Waste, fraud, and abuse, higher rates, fiscally irresponsible, and the list goes on. Well, Mr. President, even Democrats have to be well aware of the fact that Obamacare has utterly failed to do what it promised. As I mentioned yesterday, we had one Democrat senator come down to the floor during the shutdown, and to his credit, he admitted the truth, and this is what he said. He said, "We did fail to bring down the cost of health care," it's a direct quote. We did fail to bring down the cost of health care. So what are Democrats proposing to do about that failure? As I said, exactly nothing. Democrats' so-called plan is a 3-year extension of the status quo. No reforms, no revisions, no rethinking of the way that Obamacare works, just a 3-year extension of the status quo, which I might add was put in place in response to the pandemic. When they extended these subsidies back in 2022, it was in August, the pandemic was long over. Long over. You can't, as I said, you can't make this stuff up. So we're not going to do anything to address the perverse incentives that push Americans out of the employer-sponsored health care system and onto taxpayer-subsidized plans. It's not going to do anything to address the perverse incentives that encourage insurance companies to enrich themselves at taxpayer expense. It's going to do nothing to address the rampant waste, fraud, and abuse in Obamacare. And most of all, Mr. President, it will do nothing to bring down health care costs. Nothing. Zero. Now, under Democrats' plan, insurance premiums will continue to spiral. American taxpayers will find themselves on the hook for ever-increasing subsidy payments. And don't think that all those payments are going to be going to vulnerable Americans. As I said, the Democrats' decision to remove any income cap on the Biden COVID bonuses has Americans making as much as $500,000 or more qualifying for taxpayer subsidies. $500,000. Do Democrats really think middle-class families should be subsidizing health care premiums for those making $500,000? Mr. President, Democrats don't have a health care plan. They want to extend the status quo. A failed, flawed, fraud program that is increasing costs 3 times the rate of inflation. Now, on the other hand, Mr. President, Republicans today will offer something that does actually lower costs. Earlier this week, we introduced legislation drafted by the chairman of the relevant committee, Senators Crapo and Cassidy, to make structural reforms to the individual health insurance market. In contrast to the Democrat bill, our bill would actually lower, as I said, Obamacare premium costs, and it would redirect government savings from the bill into health savings accounts for eligible Obamacare enrollees earning less than 700% of the federal poverty level, paired with some affordable insurance plans. These accounts would help individuals to meet their out-of-pocket costs, and for many individuals who don't use their insurance, who will barely use it, it would allow them to save for health care expenses down the road. So we have 2 paths here, Mr. President. One, a plan to start addressing the spiraling health care costs in Obamacare and make structural reforms that would drive down premium prices. 2, a proposal for a 3-year extension of the status quo. So you tell me who's serious about actually addressing the affordability of health care. Democrats may talk about helping Americans, but their bill is nothing more than a political messaging exercise that they hope they can use against Republicans next November. And so I hope that after today, they'll feel like they've checked the messaging box and will get serious about actually doing something about the spiraling health care costs under Obamacare. Republicans are ready to get to work, Mr. President. I'm not sure yet the Democrats are interested. Mr. President, I yield the floor.
There. The fact is that 92% of people who get those enhanced premium tax credits are making $200,000 or less. And the average income for a person who receives those premium tax credits is $32,000 a year. That's not somebody in a higher income bracket. And in fact, about 50% of the people who receive premium tax credits are small business owners or their employees who have no other option for health care because they can't afford employer-sponsored health insurance. So I think much of what the majority leader said about costs and about addressing fraud and about lowering the cost of health care is something that we all ought to support. And I'm ready to come to the table, and I think we would be better served if after we get through these votes, we sit down and come to a compromise to address the real costs that people are facing in terms of health care, and I'm ready to do that. But in a few moments, we're going to vote on whether millions of Americans can keep the ACA enhanced premium tax credits or whether they will face a crushing financial blow. These credits have helped millions of families, including tens of thousands of people in New Hampshire, keep their coverage and balance their family budgets. For many, they are the only thing that's standing between stability and a crisis. And I've worked on these tax credits since 2019 when I first introduced the bill. I have warned for more than a year about what would happen to rates if we fail to address this issue in Congress. Well, now that open enrollment has begun, we are seeing the consequences of that failure to act in real time. States and insurers are reporting that significantly fewer people are re-enrolling in health insurance plans because families simply cannot afford the rising premiums. And the Republican proposal that Senators Cassidy and Crapo are introducing doesn't really address that issue. Even those who are re-enrolling are often being pushed into less comprehensive plans that leave them exposed to substantial out-of-pocket costs. Now, yesterday at a forum that I co-hosted with Senator Warner, we heard directly from people who depend on this coverage. Their stories were personal and they were urgent. One small business owner, who's also a healthcare provider, told us that affordable ACA coverage allows her to keep serving new mothers in her community while still caring for her own family. But she also pointed out that if we don't address these premium tax credits, excuse me, that the cost of her health insurance was going to quadruple. Another woman from Concord, New Hampshire, described the moment her son, who lives with a serious mental illness, had his coverage approved. She said she wept with relief. With that coverage, he's been able to work, to live independently, and to get the treatment that he needs. These are real families who have real stakes in this debate that we're having. This is not a game. People are already feeling the impact of inaction. Democrats have put forward a straightforward, immediate solution to prevent the premiums from jumping and to keep people insured. Some of my Republican colleagues have offered ideas that they believe could help, and I think that engagement has been constructive. But the time is short. We need to act now. We need to extend the tax credits. I know there are members in both parties who want to find a responsible path forward. I welcome the discussion on where we can find common ground, and I'm ready to come to the table, as I said, with any of my colleagues to work on long-term reforms.
After that became too embarrassing an option for them, they used Scotch tape and glue to come up with this ridiculous proposal that can't be taken seriously. The Republican plan does nothing to extend the tax credits for even a day. Our bill, of course, extends them for 3 years. Under the Republican plan, the big idea is essentially to hand people about $80 a month and wish them good luck, say you're on your own no matter what happens. And to even qualify for that check, Americans would be forced onto bare-bone bronze plans with sky-high deductibles, $7,000 or $10,000 for an individual and tens of thousands for a couple. So the deductibles are so high that even that is not paid for by the $80 a month. And then Americans are stuck and have nothing. The Republican plan is a when you get sick, you go broke plan. Plain and simple. The only answer, the only right answer to solve this crisis is what Democrats propose today, a clean, simple extension of current tax credits. Our bill is the only plan that halts premiums from shooting through the roof. And as Americans know, this is not a symbolic vote. This is a life and death vote for millions of people wondering if they'll be able to afford health insurance next year. Millions will lose health insurance. Tens of millions will have to change plans and doctors and get high deductibles and high co-payments that they can hardly afford health care if we don't do this. So America is counting on us, the Senate. Republicans, America is counting on you to do the right thing and vote yes on our bill. A yes vote on our bill means premiums will not double or triple or more starting January 1st. A yes vote means lower costs for the American people and greater help for them to pay for the things they need. A yes vote means dignity, security, and peace of mind for tens of millions of American families. It means our healthcare system averts a disaster. There is only one right thing to do, and that's for Republicans to vote yes on our bill. The American people will not forget which way senators vote today. I yield the floor.
Senators, in accordance with the provisions of Rule 22 of the Standing Rules of the Senate, do hereby move to bring to a close debate on the motion to proceed to calendar number 285 as 3386, a bill to provide health savings account contribution to certain enrollees to reduce health care costs and for other purposes, signed by 17 senators.
Under the previous order, the mandatory quorum call under Rule 22 has been waived. The question is it the sense of the Senate that debate on the motion to proceed to S3386, a bill to provide a health savings account contribution to certain enrollees to reduce health care costs and for other purposes, shall be brought to a close? The yeas and nays are mandatory under the rule. The clerk will call the roll.
Ms. Also-Brooks, Ms. Baldwin, Mr. Banks, Mr. Barrasso.
Live coverage today here in Washington of the U.S. Senate.
Okay, good afternoon, everybody. And I'm pleased to be joined by my colleagues, Senators Warnock and Klobuchar. And I want to thank them for being here, and not just for being here, but for their really tireless work on lowering costs that are going to just hurt so many Americans in a few short weeks. Unfortunately, our Republican colleagues refused to do what they should have done. I want everyone here to understand just what happened on the Senate floor. Senate Republicans just shoved the American people off the side of a cliff with no parachute and with an anchor tied to their feet. Republicans just blocked the Democrats' bill for a clean, simple extension of the ACA tax credits. The last chance they had to ensure people's premiums do not skyrocket in the coming months. Democrats did the work, but now Republicans chose the consequences. Now Republicans have all but guaranteed that tens of millions of people will see their premiums double or triple or more next year. Republicans now own America's health care crisis. Democrats tried all year to stop this health care crisis. We put real legislation on the floor to ensure these tax credits do not expire. And Republicans blocked it. Not once, not twice, but 13 times throughout the year. 13 times they voted against our extensions of the ACA credits. 13 times. After today's vote, the American health care crisis is now 100% on Republican shoulders. On January 1st, premiums are going to go up. All of us have had people crying in front of us, in our arms, saying, what are they going to do when they've cut off the money that pays for my daughter's cancer treatment? What am I going to do? They've told me that my dad or mom is going to be kicked out of their nursing home, which is going to...
13 times, not their lucky number. 13 times they rejected this. 13 times with the American people. So when that soybean farmer in Minnesota says to me he sees nothing but a perfect storm of ugly because of the tariffs, because of the input costs for his farm equipment, and because of his health care premiums, I'm going to tell them 13 times we tried to do this. You have already seen how the public feels about this, whether it is the Virginia and the New Jersey governor's races, whether it is the statewide Georgia races, including a recent legislative race there. They said enough. They want us to be working together to do something about their health care. And we have given them the opportunity so many times. The straight extension. And we would like to do a lot more, believe me. Reverse the cuts from the big, beautiful betrayal of the bill when it comes to Medicaid. Do something more on my legislation for negotiation of prescription drugs so we could do that faster. Public option, you name it. There's a lot of choices here. But right now, we have an immediate crisis. And as Senator Schumer points out, this is not a January thing. It's going to be set by then. This is not a February thing. This is a now thing.
Thank you so much, Senator Klobuchar and Leader Schumer. After today's vote, I really only have one question. Who do the Washington Republicans work for? Who are they working for? First, you kick 15 million Americans off of their health care in order to give billionaires a tax cut. And then after doing that, you double the premiums on some 22 million additional Americans. For some people, you triple the premiums, quadruple the premiums. Who are you working for? These are people who are disproportionately in red districts. And we have tried time and time again, as my colleagues have said, to get the Republicans to make a different choice, and here we are today. 15 million Americans lost their health care. 22 million Americans on average will see their premiums double. Just last night, I had to stand up and object to a UC that would have knocked an additional 1 million people off of health care. And my colleague, who was putting forth that proposal, like me, he lives in a state that has not expanded Medicaid. And so here we are. The Republicans have demonstrated who they are working for. Certainly they're not working for you. They are not working for the people of Evans County, Georgia, lives. And so we're not about to give up. We're going to keep fighting for those people. I've gotten arrested not once but twice fighting for health care. Dr. King said of all the injustices, inequality in health care is the most shocking and the most inhumane. And we're going to keep working at this until we center the people and get them their health care and their human dignity back.
Does not have a path forward. Neither do just reforms without an extension. So are you open to both?
Leader Thune ought to start talking to the American people. When your health care premiums double, when you can't afford medicine, when you have to switch doctors who's been on your case for so many years, that ain't political, John Thune. That's humane, and that's democracy, doing what the people want. Yes.
Bro, what are you talking about, man?
Shutdown. And when the Republicans wouldn't talk to us, it was their shutdown, and the people see it. But we are going to continue one thing that happened. The health care issue became front and center. The American people saw who was on their side and who isn't, and we are going to keep fighting as a unified caucus to get better health care for the American people, as Reverend Warnock said, plain and simple. Yes.
Bro, what are you talking about, man?
15 times, the onus is on them. Yes. You know, they're in their own political bubble. They're so ideologically wrapped around this axle. Go talk to the people. 55% of Trump voters want us to extend the ACA. The American people want this. In red states, in blue states, in purple states, northeast, southwest, it's universal. Look at the election results. Look at the election results from one end of the country to the other. The Republicans try to call it political because they don't have an answer. They're busy fighting with each other. They got 15 different plans, none of which can get close to a majority of support in their caucus. Yes.